I am going to review mental health concepts. At the conclusion of this video, the nurse should be able to identify the appropriate mental health concepts. When assessing a client for their mental health, we want to look at appearance. Are they well groomed? Are they well dressed? Speech, we want to look and see if their speech is clear, coherent, and reality-based. Sensorium, we want to be sure that they're oriented to person, place, and time, and they have good memory. Family relationships and work habits, do they have a job? Do they live with their family? Are they married? Level of growth and development. Support systems or stressors. Do they have interpersonal relationships? Do they have the support systems, perhaps a church? Are they going to school? Do they have the ability to trust? Can they cope with stress? And potential risk factors. Potential risk factors, you want to look if there is a family history of mental illness or a medical history. Imbalances such as electrolyte imbalances or other imbalances can cause symptoms resembling mental illness. Here is Maslow's hierarchy of needs. Physiological needs, right there, the biggest part of the triangle. Oxygen, water, food, sleep, and sex. Safety and security. You need to have physical safety and order in your life. Love and belonging. Are you getting affection, companionship? Self-esteem has to do with status and success and how you feel about yourself. And self-actualization is self-fulfillment and creativity. I'm going to talk about some guidelines for communication. We're going to talk about guidelines for communication. Communication is both verbal and nonverbal. Oftentimes the nonverbal will tell you more than the verbal, and sometimes what you see and what you hear don't really say the same thing. The nonverbal is the most accurate reflection of attitude. Evaluate their physical appearance, physical distance, where their personal space begins and ends, body movement, gestures, facial expression, eye contact. And here is your practice question. The client is awaiting the results of a breast biopsy. The client is tearful and restless. The client wrings her hands and says, "I know it must be cancer, or I wouldn't have to wait so long." Which response by the nurse is most empathetic? 1. It really has not been so long. The healthcare provider will be with you soon. 2. Why do you think that waiting a long time means bad news? 3. Do you feel like you have been waiting a long time for your results? And 4. Are you feeling that such a long wait means the news is bad? 1 is incorrect. It really has not been so long. The healthcare provider will be with you soon. This expresses no empathy for the client's feelings. That almost shows like you didn't hear what they're saying, which is their worry is the most important thing. Why do you think that waiting a long time means bad news? Clients perceive why questions as challenging rather than empathetic. That doesn't mean that you heard the client, and it's dealing with the long time, not their feelings about the long time. Number 3 is not correct. This response reflects part of the client's feelings but ignores that the client feels she may receive bad news. And number 4 is correct. This response most accurately reflects the thoughts and feelings expressed by the client and allows the client to know that the nurse understands her concerns. Confirmation of this understanding by the client will open the door for further ventilation of her feelings. Therapeutic communication includes listening to and understanding the client while promoting clarification and insight. The goals are to understand the client's message, facilitate the client's verbalization of feelings, communicate the nurse's understanding, acceptance, and help to identify problems, goals, and objectives. And that concludes the video on mental health concepts.